So we are now moving on to the final section of our slides, and this is called infection control. So how I've designed this is I have split it into the steps you would have to follow in a clinical procedure in the order you would have to follow them. Then I've also provided checklists to help you remember specific things in each step that you would have to follow before you could move on to the next one. So if we look here at the working environment, this would be your first step, and this would occur either before your first patient or between patients. And if it's between patients, you've got to first think of all the things that they've touched and all that, and then we would have to appropriately clean them. Then once the working environment is clean, we've assessed the previous patient's risks and how much cleaning is needed. For instance, now when we're having the COVID-19 crisis, we consider every patient as infectious. So between patients, we have to do a complete clean of the entire working environments so that it reduces the risk of one patient infecting the next. We also have to wear much more stringent PPE to protect ourselves and stop ourselves from being a carrier between patients. Then once the working environment is clean, what would happen then is that you would see the patient and do a consultation and risk assessment. You'd also decide which technique you were doing, which would affect which techniques you would have to follow, whether you would have to clean the working surfaces, whether you'd have to wear gloves and all that. And then from that, you would have to, once you've decided, you would follow the aseptic acupuncture technique. If you decided your treatment was acupuncture, which would involve cleaning your working surface if it's not already cleaned from the previous step, performing hand hygiene, gloves, cleaning the patient, cleaning the equipment. And then once all this is done, you could perform the procedure, the treatment procedure. And then after all this, after the treatment procedure, we move on to disposing of the equipment now that was infected and that is disposable. And then the equipment we reuse, we have to either sterilize it and then we have to store it for future use. So why do we need to follow infection control? Well, this is to protect both patients and healthcare workers, and it's also to reduce the risks of patients developing severe side effects from our treatments. And we don't want to cause our patients or ourselves unnecessary disease. So the infection control protocols are based on evidence-based procedures and practices that help to prevent and reduce the transmission and eliminate the sources of potential infections. And then one other thing you need to know here is what is an invasive procedure. And this is any medical procedure that breaks the integrity of the surface of the skin. So if you think now, you can think we have done a couple of the different treatment protocols we can use, such as acupuncture, cupping, moxibustion. You have to think which one of these breaks the surface of the skin. So obviously acupuncture does break the surface of the skin. Moxibustion, I've put a little star here because it doesn't have to break the surface of the skin. But if you do scarring acupuncture, then this would break the surface of the skin and then be considered an invasive procedure. The same with cupping. It's normally not an invasive procedure, but if you do what's considered wet cupping, where we first lacerate the area and then cup to draw blood out, then that is also considered an invasive procedure. But most of the time we do not perform this procedure. And then 3-edge needle is also considered invasive, as well as plum blossom needle. These are all invasive because they penetrate the surface of the skin. And then the final non-invasive procedure is called tweener, which is a type of medical massage, which obviously does not break the surface of the skin. So what this means is that obviously the invasive procedures require much stricter standards than the non-invasive procedures. And we have to be much more careful when we do invasive procedures when compared to the non-invasive. And our sterilization practices have to be at much higher standards in this case. So we're going to start with the working environment and specifically the general principles following when setting up your working environment. So the working environment is both the consultation and treatment rooms. And what we will do is we'll compare this image to the standards to see if it's a sufficient location for acupuncture practice or if it does not meet the standards. So firstly, we have to use the area we use has to be clean, dry, well ventilated and well lit. So we can see this image that there are windows here on the top left, which means it's definitely well lit and well ventilated. That's good. And we can also look at the image and see that the area is very clean. So that's also good. So I think it definitely passes the standard. Then if we look at the third point, we say we're going to start talking about working surfaces. And a working surface is any surface used during the treatment procedures. So in acupuncture, we normally consider the section here as the working surface, not the section that includes the table. So that section over there would be your working area, which would include this trolley, where you would most likely have your acupuncture needles, your alcohol swabs, and then the bed where the patient would be lying, and then the blood pressure cuffs and the dustbin is all considered part of the working surfaces. We do not consider the table and chairs as part of the working surface because you won't be doing any procedures on there. Okay, and then, so if we look at them, his working surfaces are a stainless steel trolley, which is definitely one of the best things you can use. It's both smooth and impervious and antimicrobial, so that's great. And then you must also remember to use appropriate disinfectants when you're cleaning your environment. So when cleaning this room, we also have to make sure that we use the right cleaning products depending on the risk that the area has. So if, for instance, you're having the epidemic like we're having at the moment, the cleaning standards have to be much higher than if you were just treating patients that didn't have infectious diseases. So it will always be determined by your risk assessment. Another thing to also take note is that the floor, this whole floor area here, is considered a dirty environment. Anything that touches the floor is considered dirty and should be discarded, except for stuff like if one of your cups or your forceps falls to the floor, it'll be discarded and then cleaned and sterilized, and then you could only use it again. And then also, if you interact with anything from the floor, for instance, you pick up that forceps that fell down, you have to redo all hygiene protocols. So you'll have to redo hand hygiene, and you'll have to re-disinfect this, obviously the forceps like I mentioned. So we try not to interact with the floor as much as possible. And then finally, do not eat or drink in the patient areas. Obviously, because of the increased risk infection, we try not to eat food because that's an easy way for the viruses and bacteria to get into our body. So we try not to eat or drink in the patient areas. Okay, so then we're moving on to the checklist. So this is the things you should check off before moving on to the next step. So firstly, we have to think about what does the last patient come into contact with. We also have to think about here is what risks do they pose? So are they a patient with a sore knee, or are they a patient with a flu, or do they have an unknown infectious virus, or do they have COVID-19? It all depends on these factors as to how much sterilization and how much cleaning we have to do between patients. If they are, for instance, a COVID-19 patient, then everything would have to be sterilized that they touched. If they are just a sore knee and there's no risk of COVID or any other flu symptoms, then we don't have to follow such strict protocols. But the main things you're going to look at are the linen. So if any linen is soiled, or you're using single use, like in the image here, you can see he's using single use paper towels, then you would replace them, or you would replace the soiled linen. And here, soiled linen refers to any linen that has blood or body fluids on it. Then it is considered soiled and has to be immediately replaced. Other things would be sheets, towels, and pillows. So if you put a sheet over the patient while he had the needles in, or towels to cover them, or any pillows they use, that would all have to also be considered when you're considering what has become infected. And then any objects and surfaces the patient has touched or that you touched after you were busy with the procedure. So this would include your working surface. So for instance, here it would be these trolleys, if you use these trolleys during the procedure, and then any trays on the trolley that you used and any containers that you touched, you would have to disinfect. Once this is all complete and everything is now clean, we can then move So our working space is now clean and our patient has left. So before we see our next patient, what we would have to do is we'd first perform hand hygiene. This is to ensure that no infections and no infectious material from our previous patient is transferred to our next patient. Then, once this is completed, what we would do is we'd do the consultation with our patient. And once the consultation is complete, we would do a risk assessment based on what the patient is presenting with and on what treatment procedure we want to do. So will you be performing an invasive procedure or not? If you're performing an invasive procedure, then we would move on to aseptic techniques, which will involve sterilizing our working surface and making a sterile work environment, then sterilizing the doctor, doing hand hygiene again, and possibly wearing gloves, then sterilizing the patient, making sure our equipment is sterile, and then finally getting rid of the equipment that is no longer sterile so that it has no risk of infecting others. So now that we are performing our aseptic technique, the first thing we're going to look at is the working surface. So this can vary depending on your layout of your offices, but it will either be like the picture on the left, which is a table, or it will be a trolley or some kind of trolley which will store all the items you will use in the procedure. So what will happen is you'll first have to clean this working surface before you start any procedures with the patient. And this involves using a disinfectant. We normally use at least 70% ethyl or isopropyl alcohol or 0.5% sodium hypochlorite, as we use these with a single-use wipe, as this cleans and kills most bacteria and viruses. And then the working surface is not just these things. It also includes other things such as sterile trays, the cotton balls, and the needles that you'll be using. And if you're using any non-disposable items such as the glass cups, scraping plates, sterile containers, or storage trays, or even forceps, then they should also be disinfected at this stage. And then normally our needles are already sterile, so you would just be taking out the sterile needles and getting them prepped and ready to be used. So let's talk about the risk assessment before moving on to the next step, as your risk assessment will have an effect on which precautions you choose to take. And there are two stages where you can perform a risk assessment. The first is before seeing a patient, and this can only be done if we know what the patient's condition and treatment protocol will be. And this is normally for follow-up patients who you have already seen. And then the second stage is after your consultation, as you have now determined your patient's condition and what treatment protocols you will be following. So once this is completed and you now know your treatment protocol, you can now think of the following questions. Will your face, hands, skin, mucous membranes, or clothing be exposed to blood, excretions or secretions, either by spray, coughing, or sneezing? So obviously in acupuncture, we have the risk of being exposed to the patient's blood, as when we remove needles, sometimes the needles can bleed, sometimes the points where the needles were can bleed slightly. And then this means that acupuncture has the risk of coming into contact with blood, whereas moxibustion and cupping in general do not have these risks. So that means that when you do acupuncture, you have to have higher precautions than when you do moxibustion or cupping. Then the second question is to ask yourself, what will my patient come into contact with? Which surfaces and which parts of the environment? And then will I be interacting with these surfaces and environments? And then does the patient have an infection or communicable disease, as this will affect your PPE, which is your personal protective equipment. And then there are three basic types of precautions that we can take. Firstly, contact precautions. These are most commonly used in acupuncture, as we always, when we perform our treatment protocols, we are coming into contact with the patient, and therefore we have to use these precautions. The first one would be hand hygiene. Obviously, this is to stop you from bringing in your own pathogens or your pathogens from the previous patient to the next patient when you touch them. And then we also can wear gloves. The gloves are obviously a protective device to prevent the blood from the patient touching our body. And then The second type is droplet precautions. So this is for conditions which spread and pathogens which spread through coughing or sneezing. And then obviously there's small droplets when you cough and sneeze, and then these will spread the pathogens. So yeah, we still use hand hygiene because most people cough and sneeze into their hands, so then they can spread it through touch. And then we also do wear masks. So the mask is not just for yourself, it could be for either you or the patient, depending on who's coughing and sneezing. And the third type, which is the hardest one to prevent, is called airborne precautions. These are pathogens that spread via the air. Their nuclei are very small and they can glide through in the air without any droplets, and they normally are spread through breathing, which means they're very difficult to contain. These ones we have to wear a special mask called an N95 mask, which stops them from passing through and therefore can protect the individual. So now that our working surface is clean, the next thing to do is to work on cleaning the doctor. And the first step is to perform hand hygiene and sterilize the doctor's hands. This is actually a very important step and is often overlooked. And the two types of hand hygiene we will be discussing is firstly the alcohol-based hand rubs and then hand hygiene with soap and water. So the key moments for hand hygiene, we've discussed some of them. The first one is before initial contact with the patient. This is to prevent you from transferring from patient to patient. The second time is before any clean routine or aseptic sterile procedure. So this is things such as acupuncture, the scarring moxibustion or plumb loss and needle, any procedure where we're going to break the skin surface, we need to perform hand hygiene before this. And then also if you suspect blood or body fluid exposure, then you should perform hand hygiene immediately afterwards. And then there are also a few factors that affect the safety of the hand hygiene or how effective your hand hygiene will be. The first one is jewelry. This is things like rings and bracelets. The problem with rings and bracelets is they allow microbials to stay and survive underneath them and therefore increase the total microbial count. They also, if they are big jewelry like big rings and big watches, they can increase the risk of tearing your gloves, and therefore we recommend not wearing rings or jewelry on the hands during patient care. The second factor is your skin integrity. If your skin has cuts or sores on it, this should be covered prior to working, because these cuts and sores can harbor bacteria even after washing and hand hygiene, because they are uneven and they have nooks and crannies where your soap might not get to or the alcohol might not get to. And then finally, the length of your nails. So yeah, your nails should not extend past the end of your fingers, as this increases the amount of microbials because they can hide underneath the nails. So we say no long nails and also no artificial nails. Also, the long nails and artificial nails make wearing gloves difficult and also increase the risk of tearing your gloves. So we recommend, well, you have to have short nails for this treatment. And then the final thing is nail polish, which is normally allowed as long as there's no chips in your nail polish. So what we will start with is how to perform alcohol-based hand rubbing. This is the method so that you make sure that your entire hands are clean. And this is the preferred method of healthcare. This is because firstly, it is quicker. It takes only 20 to 30 seconds as opposed to 50 to 60 seconds of the other method. And it also kills most of the germs. It's easy to have alcohol available in all areas of the hospital or healthcare facility. And the final thing is that we must also make sure that our alcohol-based hand rub has between 60 to 90% alcohol. So the first step would be to inspect your hands. The reason for inspecting your hands is we have to make sure they're not dirty, so not visibly dirty or wet, because both these factors affect the efficacy of the alcohol-based hand rub. Secondly, we also want to inspect for jewelry in case we've forgotten and remove the jewelry. Then we're going to apply the alcohol-based hand rub onto our hands. So you're going to apply enough to keep the hands wet for the entire procedure. So they have to stay wet for 20 to 30 seconds. This is normally 1 to 2 presses of the 1 to 2 blobs will normally be enough. So now that the alcohol is on our hands, we're going to place our palms together and we're going to rub them back and forth so that the alcohol spreads all over the hands. And then step 4, we're going to interlace the fingers, keeping the palms facing each other, and continue to rub the hands up and down. This is mainly to focus on disinfecting between the fingers. And then step 5 is the same motion, except we're going to put the palm of one hand onto the back of the other hand. This is to allow us to also clean the back of the hand and in between the fingers, but on the back. So next is step 6, which involves rubbing the back of the fingers into the palm of the opposite hand. And we do this towards the body and away from the body. And then we repeat it with the other fingers into the other palm. Then step 7 is to grab the thumb with the opposite hand, and we're going to rotate in a circular motion to clean the entire area of the thumb. This is then repeated on the other hand. And step 8, you're going to press the fingertips of one hand into the palm of the other hand, and you're going to rub in small circles and then repeat the same process on the other hand. Once this is completed, this is the end of the alcohol-based hand rub, and your hands are now considered clean. All you have to do now is wait until all the alcohol has dissolved and the hands are dry before you start the next step of your treatment. So next we're going to look at hand hygiene with soap and water. This method is preferred when your hands are visibly soiled. So either they have come into contact with blood or body fluids, or you can see visible dirt on the hands. And this method is going to take between 40 to 60 seconds. So this means it is slightly longer than the previous method. And that means that you will have to spend 4 to 6 seconds on each of the steps. The first step is to inspect the hands. Here we're looking for any jewelry or watch, such as rings or watches, and we're going to remove it. Second, we're going to use this time to regulate the water temperature. What you're going to do here is you want the water warm, but you don't want the water very hot, because what is found is that if the water is too hot, this will damage the hands in the long run. And if your hands are damaged, it increases the likelihood of the bacteria remaining on the hands after you've completed hand hygiene. And then the second step is to apply soap onto the hands. Here you need to apply enough soap to cover the entire hands once you are starting the cleaning process. Okay, so step 3 is to rub the hands together, palm to palm. This is the same technique as we used in the alcohol-based hand rub. What we're going to also do here is focus on spreading the soap over the entire surface of the hands. And then step 4, we're going to rub the hands together in the same motion, except we're going to rub between our fingers and focusing on trying to clean the area in between the fingers. Then we're going to place the palm of the one hand on the back of the other hand and interlace the fingers again and focus on cleaning in between the fingers but on the back ends, and also rubbing the back side of the palms. And we're going to repeat this again on both sides. In step 6, here we're going again place the back of the fingers into the palms, and we're going to rotate the hands forwards and backwards. This is to clean the back areas of the ends of the fingers. Step 7 is to again grasp the thumb with the opposite hand and rotate it in circular motions. This is to clean the entire thumb, and we're going to repeat this on the other hand. Step 8 is to take the fingertips and press them into the palm of the opposite hand and rub them into small circles, and we repeat this on both sides. Our focus here is to clean the tips of the fingers. And then step 9 is to rinse the hands under water, and here you have to point the fingers downwards. This is to allow the water to flow from the top of the hands down, and it increases the effectiveness of the water in cleaning the entire hand from soap, and it makes sure that no bacteria remains on the hands, as that will flow downwards and off of the hands. And then step 10 is to pat the hands dry using a clean paper towel. And then the final step, step 11, is to use the paper towel to turn off the tap, or you could also use your elbow to turn off the tap. So If you have not clearly understood these two techniques, what you can do is you can go to watch the videos I've attached to this lecture. They are at the end of the lecture. It is sometimes a bit easier to understand the whole process if you see it with actual video of them doing the steps. Next, we're going to talk about the types of gloves used in clinical settings. There are two main types. These are non-sterile or clean gloves and sterile gloves. So the sterile gloves are used mostly in aseptic procedures. These are procedures such as surgeries or inserting of a catheter. And then the non-sterile gloves are used whenever we anticipate contact with blood, body fluids, wounds such as ulcers or cuts, any secretions or excretions from the patient, any mucous membranes, or we are touching any equipment or any of the surfaces that have been contaminated with blood or body fluids. So they're used more often with needling, drawing blood. Then you'll see nurses use the non-sterile gloves. And then the second use for the non-sterile gloves is when you are coming into contact with a patient. You can use these gloves to help prevent the transfer of the bacteria from your body and the contaminants from your body onto your patient. And then also if you're coming into contact with your patient's environment. So this could be things like if you are taking their pulse, or you are palpating a wound, or you're palpating a tender area in the patient, you will wear gloves. And then remember that gloves are only used one time, so they're used for one single patient and then must be discarded immediately afterwards. And if you do use gloves indiscriminately, this means using it the whole day from 9 till 5. This actually increases the risk of transmitting pathogens because you're more likely, the longer you use the gloves, to touch areas that will contaminate the glove, such as touching your clothes, touching your hair, touching your face, sneezing into the gloves, and all these factors will then create all these factors change it from being a clean glove to a dirty glove, or not a non-sterile glove, but a glove with more pathogens on it. Okay, so how would one put on gloves? So we're going to just look at how to put on non-sterile gloves. And the first step always is to perform hand hygiene. So this is either using the alcohol-based hand rub or the soap and water hand hygiene technique. You have to follow that complete procedure with all the different rubbing, palms together, back of palms, all those have to be performed. Then what you're going to do is the clean gloves come in a box. So you're going to remove one glove, and you're going to try and remove the glove and only touch the cuff of the glove. The reason for this is that we do not want to put the toxins on our hands onto the outside of glove, because this defeats the purpose of the glove then. Then what you're going to do is you're going to take that glove and you're going to pull your one hand through the opening of the glove, trying not to touch the outside and only touching the inside, and you're going to pull it up to your wrist. If the glove is not fitting completely perfectly, you'll have to just leave it for now and first put on the other glove before adjusting it. Okay, then what we're going to do is we're going to perform the same procedure with the other hand, except this time we can't touch the outside of the glove because we are wearing a glove on this hand. So we're going to use the gloved hand to touch the second glove, and then we're going to also touch it by the cuff and pull it over the hand. Once both gloves are on though, we can adjust them because now they both are clean, so we can touch the one glove to the other glove, and you can therefore adjust and make sure they're fitting correctly. But remember, do not touch the inside of the gloves, try and touch only the outside. And then after this is finished, we can then move on to doing our treatment procedure. Okay, so now that the treatment procedure is finished, how do you remove the gloves? So the first step is that you grasp the outside of the glove near the cuff. You try and grab it half an inch away from the tip, the edge of it. And you do not touch your wrist with your hand because your glove is now infected by your patient, or it's dirty, considered dirty. So what we do is we grab the outside of the glove about half an inch from the edge, the cuff edge of the glove, and we pinch there and we pull the glove down and off our hands all the way, turning it inside out, as you can see in step 2. And then step three is once it's pulled completely off, we keep holding it in the gloved hand. And then what we do is we take the non-gloved hand and we insert one finger in between the glove and our arm, just below the cuff, and we try to only touch the inside of the glove, because now our hand is still clean. It's not clean, but it's clean. It does not have the pathogens of the patient, so we do not want to get those on our hands. So we're going on the inside, and then we are pulling it down again from the inside, pulling it down, turning it inside out, and we are actually covering the other glove that's in the hand, so that the one glove is inside the other glove. And then we're going to pinch hold of the inside of the glove, because we can touch that part, and we're going to keep pulling until the glove is completely off. Once both gloves are off, you must discard them immediately so that there's no risk of spreading the infection. Okay, so now we have cleaned the working environment, we've cleaned our working surfaces, we have made sure that we are clean, both our hands and our gloves, and then we're now going to make sure our patient is clean, because the patient could have bacteria on the skin surface, and we do not want that to get inside the wounds or the points of the acupuncture needles. So firstly, when you're selecting a site, make sure it's clean, so there's no visible dirt, it's free from any cuts or wounds, and there's no infections. Then you're going to prepare the skin, and how we do this is, on all the sites we plan to needle, we're going to use an alcohol swab with at least 70 to 80% alcohol, and we're going to take this in our gloved hands and we're going to wipe the area to be needled. This is to ensure that this area is disinfected. If you plan to touch the points again after you have swabbed them, which you might want to do to palpate the exact location right before you're needling, then it will also require you to swab your fingertips, especially all the fingertips that will be touching and palpating. Once this is done, we have to wait a few seconds for the alcohol to dry. Then you can now palpate as needed, and then you can needle the points. Also inform the patient that you are disinfecting these regions and that they should not touch them now once it's been disinfected. Otherwise, they obviously are bringing in contamination to your sterile environment. Okay, and then the final thing that we need to make sure that is sterile before our procedure is the equipment. And here we're going to just talk about the needles specifically. So it is preferable to use the pre-packaged disposable sterile acupuncture needles, because these ones are one-time use only and they come sterile. So you don't have to worry about sterilization, and you don't have to worry about the transfer of pathogens from one patient to another, such as HIV or hepatitis. And the types of things that we can use that are disposable are normally the needles. You can also get disposable plumb bossel needles and 3-edge needles, and then the swabs and the cotton buds are both disposable and will be single use, and they both come in sterile forms. Also remember that we only use needles once. We only use these needles once, and that after use you throw them into a special waste contamination basket, which is then disposed of in an incinerator. And then also try and open the packaging right before you're about to use it. This reduces the risk of contamination of the needles. And when you're handling the needle, do not touch the shaft of the needle, because this is considered a sterile environment. So if you touch it, you are then contaminating the needle, and it will have to be thrown away. So what we do is we normally hold the handle and the tube, and then we place it directly onto the patient. If you do need to hold the shaft of the needle, such as when you need any points on the buttocks, you might need to use a much longer needle and have to touch the shaft of the needle. We then use either an alcohol swab or a sterile cotton ball to grasp the shaft of the needle, and then we perform the double-handed insertion known as the hand-holding insertion. And then after the treatment, needle after the treatment and all the needles are removed, remember to discard the needles immediately, as the needles, undiscarded needles, pose the risk of a accidental sharp injury. And then also press the area with a sterile cotton wool bud or ball after you have removed the needle. This can help to reduce the risk of bleeding. Next, we're going to talk about the equipment which is not single use or disposable. This is things such as your cups, your sterile trays, your forceps. All these things will be used on multiple patients and multiple times. So then we follow a slightly different protocol to the needles and the disposable equipment. So firstly, you have to decide on which protocol you will be using, because this will change the sterilization methods. For cupping, for normal cupping, we generally disinfect the glass before each use and after each use with the appropriate disinfectant, as we are not breaking the skin surface, so we do not have to form for such strict protocols. And this is the same for all the other equipment, such as the sterile trays and forceps. They can just be disinfected between patients. But anything that comes into contact with body fluids or the blood needs to be removed from the working area immediately after the patient is treated, and it then needs to go for further disinfection. And this method of disinfecting will be mentioned in the following slides. So now that we have learned how to sterilize all the different aspects of the treatment procedure, I want to talk about some common mistakes that I see people making that can compromise the integrity of your sterilization and sometimes even contaminate your sterile field. And the goal here is not to make sure that you never make mistakes by listing all of the possible mistakes. The goal is to help you to be able to quickly identify when you have made an error and have probably compromised your sterile field. And if this does occur and you believe your sterile field is no more sterile, what you have to do is you have to re-sterilize everything, starting with your hands. Okay, so the first and common one is touching your clothing. So once your gloves are on and they are considered clean gloves, or they are the sterile gloves, either option, if you touch your clothes, the sterile gloves are no longer sterile and the clean gloves are no longer considered clean. The same occurs when you touch your face or if you touch your hair. Another common mistake is not tying up your hair if you have long hair. Also, if you use the incorrect sterilization technique. So when we sterilize the body, what we normally do is we start in the center and we do concentric circles going wider and wider away from the central point. If you use other techniques or you don't wipe in the right areas, this can lead to this area not being properly sterilized. Or if you do not wait for the alcohol to dry, then this also leads to the area not being properly sterilized. Another way is if you cough and sneeze into your hands once your gloves are on. Normally what we do in this situation, if we need to cough and sneeze, is we either cough or sneeze into our elbows, or if you are coughing a lot or sneezing a lot, you could decide to wear a face mask to help protect your patients. Another common one is to touch the body of the needle. So most people are good and they do not touch the needle with their other hand. But sometimes when you are holding the needle with your insertion hand, people like to hold as close to the bottom of the handle to help make insertion easier. And if you go too close to the bottom, part of your hand might end up touching part of the body of the needle, and this has just contaminated your needle. If this does happen, you'll have to throw away this needle and use a new needle. And then also touching any objects that are on the floor or any objects below our waist. This is also considered as unsterile, and this will contaminate your clean gloves or your sterile gloves. These are even things such as a step stool or a low chair. We try not to touch anything once our gloves are on. And then finally, carrying anything over a sterilized area. So if you have just sterilized a part of the patient, and then you start carrying things over it, this is considered a compromise of your sterile field. Okay. So next we're going to talk about how to dispose of clinical waste. So there are two main types of clinical waste that you'll need to dispose of. This is sharps and needles, and then it's also any items that have blood or body fluids, such as alcohol swabs, cotton wool balls, anything like that. So the used disposable needles and sharps, what we do with those is we directly dispose of them into a box or bin called a sharps bin. And this is a special bin that is designed to prevent needles being removed or falling out of it, and also has a special mechanism preventing the opening of the box once it has been sealed. This box we normally seal when it's 3/4 full to help reduce the risk of any needles falling out. And then the sharps bin must be collected by a licensed collector for incineration. Then the second type of waste, which is the waste which contains blood and body fluids, this is considered infectious waste and therefore is disposed of in a red plastic bag. It's labeled as infectious waste, and it's then to be collected by a licensed collector for incineration. And both of these we normally keep disposal records of our clinical waste so that we can check, so that if we ever checked, we can show that we have been disposing of our clinical waste according to the regulations required. So now we're moving on to sterilization and storage of needles and equipment. So the general principles here are, firstly, that you regularly check expiry dates on all pre-packaged equipment. This includes things such as needles, your alcohol swabs, and your sterile cotton wool balls or earbuds. And then all this equipment is stored normally in a cupboard or a storage container that is clean and dry. This is to prevent the growth of bacteria or fungi. We normally also prefer a locked cupboard because if your cupboard doesn't lock, this has a slight risk of causing an injury to a patient or a child, because if they can open it, you might have a child that comes in when you're not watching and takes out one of your needles and accidentally injures themselves with it. So we like to have a locked cupboard for these kind of things, especially anything that's sharp and can injure patients or can injure children. And then all your non-disposable items which come into contact with our patients, such as cups, scraping plates, dressing cylinders, sterile containers, and forceps, should be stored in a clean ventilated area, and we normally like to store them on a clean paper towel to reduce the amount of contamination to these items. So this table here shows the recommended methods of sterilization. The first method is known as steam under pressure, and steam sterilization is the most widely used method for acupuncture equipment. The reasons for this is that it's non-toxic, it's inexpensive. As you can see, well, you can either use an autoclave, which is a bit more pricey, or a pressure cooker. It's sporicidal, which means it kills both the viruses and bacteria and their spores, and it's much quicker than other methods. So when you are doing this kind of sterilization, you have to take into account many different factors to make sure you sterilize the equipment correctly and that they actually are sterilized. The first one is the amount of pressure. As you can see here, you have to make sure that you have 15 pounds per square inch of pressure. Secondly, you have to monitor the temperature and make sure you get sufficient temperature for sufficient amount of time. So as you can see, at 115 degrees Celsius, you'd have to go for 30 minutes. Whereas if you went up to 134 degrees Celsius, you would only need to go for 3 minutes. So the time is affected by how high the temperature is. And then the other two factors is the load size, which is how much you're trying to sterilize, the quantity, and then the load placement. And normally what we do is we place the load in the center of the pressure cooker or the autoclave. And if it's in a pressure cooker, we have to raise it slightly off the ground so that it does not sit in the water that is in the pressure cooker, as this will mean it's not getting sterilized correctly. And then the second method, which is known as dry heat. This method is used most commonly for stuff that cannot handle moisture. So things that are made out of paper or wood and that cannot handle high heats and moisture. And what you can see here is that the temperatures are much higher and the time is much longer. So that's why this method is not as well preferred, but it's also relatively easy because most people do have an electric oven which they could use. And then the final thing to remember here is that you also need to sterilize or decontaminate the storage container for whatever you have just used in the sterilization methods. And anything you use to take out the items that have been sterilized also needs to be disinfected. So if you cannot take these things out with your hands, you would have to use a forceps that has been sterilized or disinfected. And then finally, I also have some homework for the class. So I have 5 videos that I've attached to the end of this lecture slides. And what I want you to do is I want you to go watch all 5 videos. And if you cannot access them at the end of the lecture slides, we can also make them available via the links. And then when you watch the video on this creating a sterile field, what I want you to do is I want you to write up a 1-page summary of this technique, focusing on the techniques you would use to help prevent contamination of your sterile field. A good example, and I've discussed it in my own slides, is not carrying anything over the sterile field. That's one example of how you would prevent contamination of your sterile field. Okay, and then